Addiction can affect anybody. With the increase of fentanyl being mixed in with illicit drugs, now increasingly means that overdosing could occur as well. Places like college campuses especially are a large target for these drugs to be distributed, and therefore poses even more of a risk. It is an incredibly serious subject as deaths relating to overdosing have been increasing almost every year since the turn of the century. Knowing what to do in case a friend, a neighbor, or even a stranger starts overdosing could be the difference between death and saving a life. That's why today I will be sharing with you some important steps you should take if you are a first responder to a potential overdose. The very first thing you should do is check for signs that a person is overdosing. There are a variety of ways to do this, as well as to assess if a person is conscious. Some of the signs that a person could be overdosing is unconsciousness, slow or shallow breathing, or their lips or fingernails are turning purple or blue. If a person is showing any of those signs, then you should try to stimulate them. Calling a person's name is a great way to check if they're conscious. If that does not work, you should rub your knuckles into their sternum. You should do this really hard, as it's very important to see if they're conscious. If they respond to either of those stimuli, try your very hardest to keep that person awake. The next important step, and one that should probably be done simultaneously for checking for an overdose, is to call 911. While being properly trained on what to do if an overdose occurs is incredibly important, paramedics have much more medical expertise and medical equipment that'll help save that person's life. You do not need to be the person to call 911, as you should probably be taking care of the person and checking that they are conscious. A great way to ensure that 911 is being called if there is a crowd is to point to a person and tell them that they're going to call 911. Make sure that they give basic information. The operator should be told that someone is unconscious, and they should be given as detailed of a description as possible. This could either be an address or as detailed of a location as possible. Time is incredibly important, so getting paramedics on the scene as quickly as possible is a must. The next step is one of the most important, and that is administering naloxone. Also referred to as Narcan, this is a drug that helps reverse the effects of an overdose. It saved a lot of lives, and there are a variety of ways to obtain it. WVU and Monongalia County have events throughout the year, so if you're interested in acquiring one, keep a lookout for them. I personally don't think that I will ever need to use this, but in the off chance that I do, I got one, and you should probably do so as well. Narcan is a nasal spray, so it is administered through the nostril. Quickly remove the Narcan from its packaging and insert the tip of the nozzle into the nostril. Make sure that you hold the nozzle firmly and with your thumb on the red plunger. Tilt the person's head back gently and then administer the Narcan by depressing the red plunger. Narcan normally comes with 2 doses, so if the person does not respond or falls back into unconsciousness, administer another dose every 2 to 3 minutes. The final and most important step is to put the person in recovery position. If a person wakes up from a Narcan dose, they need to be able to breathe. The recovery position helps in 2 different ways. Firstly, it keeps the airway open. It also prevents vomit from blocking a person's airway. As soon as a Narcan dose is given, a person should be put into this position. The rescue position is shown in the picture in the slide. Carefully turn the person to their side and then bring their knees up. Bringing their knees up is extremely important because it prevents the body from rolling further onto their stomach and having the same problem. Their hand should also be supporting their head in order to prevent rolling as well, so that their head does not turn any further. After putting the person into recovery position, continue to monitor them and wait for medical experts to arrive. Finding a person who is overdosing is an incredibly stressful experience. It can overwhelm a lot of people. However, understanding what steps to take will save lives. The 4 steps outlined in this presentation are simple, but effective in helping reduce the amount of deaths by overdose. Checking for signs of an overdose, calling 911, administering Narcan, and then putting the person in recovery position should be done in any instance of potential overdose. In 2020 alone, 91,799 people died by overdose. Educating people on what to do if they see an overdose will greatly reduce those numbers and help eradicate these terrible tragedies. These are my works cited. Thank you for listening.